This new name, regenerative cell therapy, comes from the fact that we know that embryonic or baby undifferentiated cells have the ability to be placed in different areas of the body, and they become the spare parts, so to speak, cells that will inhabit, let's give an example, heart tissue, and become heart tissue. Now, there was a lot of moral and ethical aspects of using embryonic cells, or even cells that were coming from somewhere else, or even animals. And of course, that had a lot of controversy, and it never actually developed into a complete therapy or an accepted therapy. What is now known is that we have found that you carry your own spare parts. So your body fat has these cells that are called primitive or non-differentiated cells, and depending on where you can harvest them with modern techniques that we use, biochemical techniques, and at that same moment go back and implant them. I'll give you an example. Our cardiologist, Dr. Parcero, has won the National Prize of Cardiology in Mexico because of his investigation in regenerative cell therapy. What he has done, he received patients from the US, from a very well-known university, that had heart disease, and their percentage of it's called ejection fraction, but let's call it just the function of the heart, was down to 20%. So these patients were basically non-mobile. They go down. Dr. Parcero does this implanting of these cells. We harvest them in a biochemical lab, which is part of the operating room where we're working at. We harvest them with special liposuction technique, around 700 milliliters, or let's call it's 2 to 3 glassfuls. Then we harvest those specific cells, and then we go ahead back and intravascular placement, which is basically a thin catheter going through the arteries all the way to the heart, very similar to heart stent placement. So what he does is he injects these cells in the area that has a lesion, an infarction, a heart attack that causes lesion in the tissue. And 2 weeks later, the tests that are being performed, or the follow-up tests that are being performed back at the center of the university in the United States, they're finding that from a 20% functionality, it goes back to 50%. And that clinically means that the patient now can walk. Now he can function. So this is dramatic, this is incredible, this is revolutionary for patients that are suffering diseases like heart disease, lung disease like COPD, etc.